So I ended up at Elmsleigh House because my local dentist sent me there. I went to him because I had teeth problems, perpetual toothache and loose teeth. He could do something about the toothache, but he recommended that I go somewhere else for the loose teeth. I met with Tim, Dr. Thackrah at Elmsleigh. He gave me a range of options, basically starting from continual visits back to the clinic over a period of years to sort out the teeth issues, kind of piecemeal, so one or two at a time. All the way up to the option we eventually went for, which is basically implants, upper and lower implants, to replace my original teeth with bridge work. Gave me the option of removing all of the teeth in one go and replacing them with 14 implants and bridge work upper and lower. The reason why I chose that is because A, I was lucky enough to be able to afford it, for one, because it's not cheap. And the other one was all of the other options would have involved more time going back and forth to the dentist. The treatment was in a number of phases. The first phase was stabilise my existing teeth because they were giving me real problems. Whilst that was going on, then Tim, I guess, was chatting with his team about the plan for getting me to where I am today. The first phase of which was to remove all of the existing teeth. So we used temazepam, I believe, because I don't remember anything about it, which was great because it didn't hurt at all. Remove all the teeth, and then from that point let all that settle down, and then wear dentures. Then go back and have the holes drilled for the implants. Again, temazepam was king. And then from that point on, really just finagling the implants, making sure that the gums healed correctly around the implants. So again, wearing dentures with caps in the implant sites. And then going back for, I can't remember how many fittings for bridge work. The bridge work that I ended up with, I chose the colour of the teeth. I chose in consultation with Tim. We came up with the colour of teeth, and also the number of teeth in each bridge was dictated partially by the number of implants, but also by what was going to work with my mouth. So it was a consultation process really, and you know, at every point Tim was interested in my opinion. I'm very happy with the bridge work and how it looks. It actually looks better than the original teeth. The bridge work is indistinguishable from the original teeth in daily use and in the way it feels. The only difference is the way you clean them, really, and even that's not that different. The teeth need less looking after than natural teeth, but the implant sites need more looking after. So you have to get to grips with flossing between the bridge and the gum, which is a bit odd when you first do it, but you soon get used to it. I mean, it took me about, I guess, a week to get to grips with just getting the floss in the right places. And then I can pretty much clean them now, start to finish, in about 15 minutes. The difference between now and when I first went to Elmsleigh is that now I rarely, if ever, get any toothache. And the only pain that I get now is self-inflicted. It's because I've been a bit brutal with the cleaning. And also I've got no loose teeth, so you have confidence in eating odd things. And just generally, it's a nicer feeling all around, just to not have to worry about the fact that your teeth are or they're loose. So it gives you a lot of confidence. The treatment I had was a fixed price quote that Tim gave me at the beginning of the treatment, which, you know, spanning 4 years was very decent. And absolutely, yeah, there's no question in my mind that had I chosen certainly one of the early options, which was to keep going back to the dentist, I think over the 15-year period that we were talking about, I would have spent exactly the same money. So yeah, absolutely, it was good value. Elmsleigh House is not, it's a dentist, but it's a dentist with a bit of a difference because they're very keen on looking after you. But also the aftercare has been super. Any point of any problems, I can just phone up, ultimately speak to Tim if I need to, and they're addressed straight away. It's not an issue at all. I'd be quite happy to recommend someone else to go and see Elmsleigh if they had the same kind of problems as I do, or I had, I should say. Yeah, without hesitation.